Hello, this is Dr. Arun here. So a very important aspect of hair transplant surgery is a pre-surgical consultation wherein we need to explain a lot of things to the patient because it is very important. The patient who is coming to you is your patient for lifelong. So we have a patient here who is 38-year-old. So we have to understand why age is also an important criteria when we look into the patient. So for example, this patient has come to us for a hair transplant. Now I have drawn a rough hairline for him, which is going on like from the mid-frontal point towards the lateral hump here. Now, what is important here is we need to understand that it is a typical of genetic pattern baldness. So when we ask that how old is the patient, we need to give him a matured hairline, not a very flat hairline. That's number one. Number two is a lot of patients might ask you, why not we just go down and build the hairline much flatter? Now we got to understand that typically in this kind of pattern baldness, the native hair which is here, we're also going to be losing the hair from this native part and this hair. So what happens is automatically after a few years, the patient might come back to us saying, oh, we have lost the hair here and I need to increase the density. So for that period of time, we need to have some hair which can be taken from the back or the donor area. Now imagine if I am going to bring the hairline lower, much lower than this, I would require much more number of grafts. So for example, if you can just show that, so he is a young guy, this photograph, and he wanted a hairline much flatter and much better. So we have although created a good hairline, but since the vertex is not shown, what we have done here is we have skipped the hairline here. But the advantage of this guy when we did a hairline and the restoration of the mid scalp was we could harvest a lot of grafts from the beard area as well. Now that's another important factor which we have to understand when we are doing a hair transplant. A patient like this who is a very dark skin, we can't harvest beard. The problem is like if we start harvesting beard, so we'll have lot of hypopigmented areas and patches which will be left behind. So this is a big problem when we do it for the darker skin tone. So if we cannot do it from the beard, so we are left out with only one donor area, which is the scalp. So as I told you, if I am very aggressive with my hairline in terms of getting the hairline lower or making it flatter, I require much more number of grafts, which is going to be very tough for me now. And then at a second stage, maybe after 3 years or 4 years, if I need to harvest, I will be not left out with any grafts at that point of time. So a very important part of our pre-surgical consultation is to explain the patient why we have to do a hairline in this way. The patient might ask, okay, just bring down the hairline a much little lower, but you have to explain why it is important that we should not be very aggressive with the hairline. What I have also done in this hairline is I have created this small molds, which is going to look like the hairline is much lower than if I would have just kept like this. The second thing what we will be doing is we will make this hairline, which is called as a transition zone, a little less denser than the defined zones and the frontal tuft, which has to be much more denser than this front one. We will also be creating a little bit of a temporal peak because those temporal peaks are going to give us a more naturally appearing look, because once you created this, it looks like the patient is not wearing a wig. If you don't create this, it will look like the patient is actually wearing a wig. The last thing which I normally explain to all our patients and all our doctors who come to our workshop to learn hair transplant and to also all our patients is, do not go for the vertex area on the day one. The stage one, when he has come, we are not going to be doing the vertex. We will be starting from the front area, because from the vertex, when you see a patient from the front, it is basically the front which is coming, the frontal area. So the vertex is something which we should be skipping for the last, because if we start doing this, we require a lot of grafts and then we will not be able to fill up this area. So it's very important that we start from the front. Maybe we take 2 days and try and fill up these areas. Maybe at a later stage, if the alopecia is settled down, we can go in for for the vertex area at a later stage. So I'll be posting up all the videos of this patient once we have done the hair transplant and post-operatively after 6 months when we have got the final result. So number one, be careful with the hairline, talking to the patient, pre-surgical consultation. Of course, you will be taking all medical history and etc. And second thing, explaining the patient why the hairline has to be like this. Consider the skin color because you can't harvest from the beard area, and consider the age of the patient also when you are doing a hair transplant because you need to give a matured look. That's how we do a pre-surgical consultation. Apart from the other things, these are the most important things we have to consider. So keep watching our social media area, and we will be posting more such informative videos for you.